Hello and welcome to Health Dialogue Show. I am Dr. Bhumika, and as we observe World Health Day on April 7th every year, we're taking a moment to reflect on the importance of good health and well-being for all. This global day serves as a powerful reminder of the value of health in our lives and the steps we can take to protect and improve it. To help us better understand the significance of this day and gain some practical health insights, we are joined by Dr. Sandip Pal today. Dr. Sandip Pal is a consultant. He's an MBBS, MD General Medicine, and DM Gastroenterology, currently practicing at Rabindranath Tagore International Institute of Cardiac Sciences, Kolkata. Dr. Pal is a lifetime member of the Indian Society of Gastroenterology, Society of Gastrointestinal Endoscopy of India, West Bengal chapter of Indian Society of Gastroenterology, American College of Gastroenterology, and member of the American Society of Gastrointestinal Endoscopy. Dr. Pal's achievements extend beyond clinical expertise with awards such as Young Investigator Award in ISG Con 2011 and recognition in the Torrent Young Scholar Award. We welcome you to the show, sir.
Thank you.
Okay, sir. So let me start with the first question. So, what is the significance of World Health Day, and why is it important for the general public to be aware of it?
So, World Health Day is celebrated on this day of 7th April because of the World Health Organization was founded on this day. So, what they do is every year they create some topics and they take initiative to spread awareness among the general public at large about the various disease conditions that we have, and so that the health condition of the society can be improved. Like this year, the theme for 2025 is Healthy Beginnings, Hopeful Futures. So the significance of this day is just to create awareness among the common people about all the common diseases that are there in the society. Like, for example, as I am a gastroenterologist, I can tell you the awareness about fatty liver disease is very important because this is one of the diseases which can lead to cirrhosis and liver cancer. So it's a very noble objective, and it's very helpful, at least for the doctors and the paramedical staff, so that we can create awareness about the common diseases and spread this among the people.
Right, sir. It's very important for the people to know about it, and therefore, my next question to you is: what are some of the small but powerful habits, including food habits, people can adopt to improve their overall health?
So, as I am a gastroenterologist, I will talk on the subject of gastroenterology and liver diseases. Like, for example, as I have just told you about the fatty liver disease. So, fatty liver disease is a very it's a upcoming problem. So that, see, if you see most of the people in the society or the young kids also, if you see, most of them will be obese. So this obesity is crippling the society, and obesity as a part of metabolic syndrome is responsible for fatty liver disease, which can progress to cirrhosis of liver and thereafter to hepatocellular carcinoma if not corrected. So apart from food habits, like we should avoid high calorie food, and more than that, more important is we should avoid this sedentary lifestyle. So what we have to do is we have to explain to our patients, and what we have to create awareness is the physical activity, which is very important for all of us, so that you can avoid obesity. So if you can avoid obesity, you can avoid fatty liver disease, then diabetes mellitus, hypertension, dyslipidemia, so all these things. So the food habits are very important: what to eat, what not to eat. Carbohydrates are the main responsible for weight gain, so carbohydrates have to be avoided, fats also to be avoided to certain extent. Protein is good for the body, and high roughage content, and green leafy vegetables and fruits, all these things we have to advise to our people, and we have to create awareness for the general public at large. This is in respect of fatty liver disease. Other than that, also for gastrointestinal diseases, like very often we eat food from outside, like the food that are available in cart, telagaris, and also these are responsible for the infections that are spread. Like among the gastrointestinal infections, for instance, you can take hepatitis A, hepatitis B, hepatitis E, and all these things. So we should create awareness about this. And for hepatitis B, we should create awareness about vaccination, so that, because hepatitis B vaccine is available, so that this can be prevented.
Right, sir. So my next question is again a follow-up, like how can a balanced and healthy diet really make a difference in preventing common health problems like diabetes or heart diseases, gastrointestinal problems, and others?
So common, as I said, the balanced diet is very important, because if you don't balance your diet, because most of the times as Indians we take more carbohydrates, and among Bengal, the rice eating population like in Bengal and South India and all, or even if you take roti chapatis also, these are also very high in carbohydrates. So if you take more of carbohydrates, what happens is, and this increases the weight of the patient, and the carbohydrates are mainly responsible for diabetes and dyslipidemia and so on. So this we have to advise to our patient that a balanced diet is very important. Diet should be more in like content of green leafy vegetables, and we have to avoid fatty diet also.
Alright, sir. So, like you already spoke about the importance of physical activity and exercise. So, what's your advice for people who struggle to stay active? Like, are there any ways to include exercise in a busy daily routine?
So what you can do is, for I will take my example, like I'm very busy every time, entire day I'm in the hospital. So what you do is, this way, when I'm in hospital, when I'm going to the wards, so I try to avoid the lift as far as practicable. So you use the stairs. So when you use the stairs, you walk more, so you burn up calories. So these are very simple and common things which you can do. Then everyone is busy, and most of us do desk jobs. So desk job is to come to the hospital at 9 o'clock and you go at evening 6 o'clock. So whatever time you get in between at home, because you don't have time to go outside, you can use the treadmill for walking, or you can, if possible, which is a very good exercise, is cycling. You can do a cycling and also brisk walking. So see, it's not possible for everyone to go to gym and do workout. So the best thing is, you can have a treadmill exercise, and you can inculcate the habit of brisk walking. And according to me, brisk walking is the best mode of exercise which can be done. And in between walk also, in between work, when you're working in the hospitals or offices, we can walk, avoid lifts. So this is how you can do regular exercise.
Right, sir. So, my next question to you is, what role does mental health play in overall well being, and how can people start taking care of their mental health?
So if this is very important. So if you are mentally okay, then only you will be physical well-being will be ensured. So mental well-being is very important. So for this, the main factor for mental breakout nowadays, or thing is that stress and anxiety. So as far as practicable, we should try to avoid stress, because day-to-day life, and nowadays because of the extreme workload, or you can say whatever may be the reason. So mental stress is the main problem. So if you are mentally not good, your physical well-being also will be affected. So try to be happy, and try to like do some amount of physical activity. So if you can do some amount of physical activity, mentally also you will be fit. And it's very important that we avoid stress, and whatever way possible, we should always try to avoid stress, and take a good sleep. Another important thing is, don't like most of the times we spend our time in laptop and mobile and all these phones. So this at night, when you are seeing your laptop or mobile, so that hampers your sleep. It's very important to get a good sleep. So if you get a good sleep, then your stress tension will be also be less. So it's very important to get a good sleep.
Right, sir. So, my last question to you is, with so much access to social media these days, and we have so much of health information online, so how can people identify what's trustworthy and what's not?
So this is very important, because many of my patients, they come and they read something in the Google, and they tell that this disease is there. So what is important is, don't trust on this all social media videos and all this. You can go to sites, the responsible sites, like for example, our hospital Narayana Health, we have a site where you can go. Among all the common diseases, there are some lectures by some of the consultants about, like fatty liver disease, or hypertension, or diabetes, or obesity, or cancer. All these things are there. So you can go to the website of the hospitals or the health organizations like WHO, or like we have our own societies like INAZL, or the Indian Society of Gastroenterology, Indian Society of Liver, INAZL, which we call. So these sites, if you go, here also some informations are given about common health problems, and also like WHO and UNICEF and all these things. Everywhere some health related topics are given, or the responsible, like if you see Mayo Clinic and all this, so something will be written about the diseases, the common practices that you should rely on that. Just don't Google anything, and whatever comes out like Google News, don't rely on that. I don't think that is reliable. And maybe because the context in which they write this may not be the interpretation may not be okay. So it is very important to go to sites which are responsible. And one my simple advice would be to go to the sites of big hospitals, big hospital groups, so there you will get the correct information.
All right, sir. Thank you, sir, for giving us your time. It was a very brief yet a very informative session. Thank you so much.
Thank you very much.